How does a TIA increase your risk of future stroke? Imagine a warning sign flashing on your dashboard, alerting you to a potential problem. A transient ischemic attack, or TIA, is just that, a warning from your brain that something isn't quite right. It happens when blood flow to part of your brain is temporarily blocked, causing symptoms like weakness, speech trouble, or dizziness that usually last less than an hour and then go away. Even though symptoms resolve completely, a TIA is a serious signal that your blood vessels may be at risk of more severe issues. It indicates underlying problems like narrowed arteries or blood clots that could cause a full stroke later on. Research shows that people who experience a TIA are about 4 times more likely to have a stroke compared to those who haven't had one. The highest risk is within the first 2 days after the TIA, and about 1 in 10 people will have a stroke within 3 months. In fact, roughly 1/3 of TIA patients will eventually suffer a full stroke if no preventive steps are taken. This is because the temporary blockage during a TIA often points to ongoing vascular issues, such as atherosclerosis, which is the buildup of fats and cholesterol in the arteries, or blood clots forming in the heart and traveling to the brain. These problems make the blood vessels more prone to blocking blood flow for longer periods, leading to a stroke. Several factors can make the risk even higher. Older age, especially over 60, high blood pressure, diabetes, and heart conditions like atrial fibrillation all increase the chance of a future stroke after a TIA. The severity and duration of symptoms also matter. If symptoms last longer or are more intense, the risk is greater. Imaging tests often reveal significant narrowing or blockages in the arteries supplying the brain, which further raises the likelihood of recurrent events. Because of this heightened risk, immediate medical attention after a TIA is crucial. Doctors can perform tests to identify the cause and prescribe treatments such as antiplatelet medications or blood thinners to prevent clots. Managing blood pressure, controlling blood sugar, quitting smoking, and adopting a healthier lifestyle are also key steps. The goal is to stabilize the blood vessels and reduce the chance of a full stroke happening later. Understanding that a TIA is a warning sign can motivate timely action. It's important to remember that each person's risk factors and health situation are unique, so personalized medical advice is essential. Recognizing and treating the underlying issues early can make a big difference in preventing a future stroke and preserving quality of life. Always consult healthcare professionals if you experience symptoms of a TIA or have concerns about your stroke risk.